is my baby.
I'm Dana Denha.
And I am Melissa Bondi, and this is Adventures in Parenthood. Throughout this series, we will explore the world of raising kids from newborns to adulthood.
If you ask around, one of the biggest fears women have while pregnant is the delivery process. For first-time moms, you have no idea what to expect. How bad will it hurt? Are you putting your baby and yourself in the best hands by choosing the right hospital or midwife? Everyone's experience is unique. But with that being said, you can help others by sharing your individual story and letting them know that anyone's story is okay. And pretty much you got to be open to whatever can happen.
Oh, absolutely. And I think between you and I and our stories and what came first, and friends and family around us, we heard, at least I know I heard many, many different stories and situations. And we were older, so it was almost like we could take it all in and kind of make our own, this, like, what's going to happen. And there's no way to predict it.
Yeah, you really, that's why when they say, like, have a birth plan, I think your birth plan needs to be really open to just going with the flow, too. Because I actually remember them talking to me about having a birth plan, and I was like, I don't have one because I just don't want to have any expectations of what was going to happen in the delivery room.
Oh, had it like maybe not gone according to plan?
Yeah, like I didn't need music playing or this or that. I guess my one birth plan was to get an epidural. That was me. I know everyone else, like, kind of, a lot of people decide that maybe they're not sure beforehand, but I was like, I know I want an epidural. That was like my big plan.
That was part of my plan for sure. Yeah, for sure. I don't know that I really had a plan either. I think I did look on Pinterest and to see what I needed to pack in the bag. And check, the bag.
But even like that sort of thing, like, oh, I need a really cute outfit for the baby to wear home. It's like, who cares? Like, as long as your baby's clothed, it doesn't really matter what they wear home. But yeah, I mean, like, our stories are not the same. We had similar things happen. So
I remember texting you when I heard you went into labor and you were at home and having contraction. I remember texting you going, what's happening? How do you feel? How does it feel?
Yeah.
I didn't have that.
Yeah, because
I didn't have that
induced.
situation.
Yeah.
Right, so I didn't really know what it was like to have contractions at home. And I remember texting you going, oh, I wonder how she's doing. I said, okay. How bad is it? Is she keeled over? Is she talking? Like, what is she doing?
I think if you're at that point, then you go to the hospital if you're keeled over.
Right.
Honestly, because that was one of the things we were talking about before the show, is like, before you have a baby, you don't know what contractions feel like.
Right.
So like, people are like, they're really bad period cramps.
Yeah.
And I was like, I just can't imagine how bad a period cramp that bad, even though I've had some bad ones. But honestly, like, if you just go into labor on your own at home, it's like you notice it, but it doesn't hurt that bad at the beginning.
Okay.
So like, it intensifies. And like, by the time I was home alone most of that day, and then my mom and sister were like, we're coming. You don't have much time. So by the time they actually showed up, and I was like, don't rush, it's no big deal. And then they show up, and it was like, let's walk around the court a couple times, and then it was time to go to the hospital, really.
Okay.
So like, by the time I was like, yeah, okay, come over, it was time then.
Right, and that's your story.
Yeah.
Right, and you get to share that knowledge. That's your situation. That's what happened. That's what could happen to someone that you know.
But we both ended up having C-sections in the end because I couldn't get my baby out, and neither could you.
Yeah, no.
You know.
Absolutely. So today we find that we live in an area where you can expect the best when it comes to medical services. And St. Joe Ann Arbor is reaching for the stars when it comes to patient care. You'll experience departments all over the hospital, but we're here to discuss strides being made in their women and children's services, more specifically the Family Birth Center. And joining us today is Ruby Shapiro. She's the clinical nurse specialist for the Women and Children's Unit at St. Joe's Ann Arbor. Welcome to the show.
Thank you. It's great to be here.
Yeah, we're excited to have you. So we've got quite a bit of questions for you for this department that has, it's growing and expanding and different than when Dana was there and she was at the same place. So yeah, tell us a little bit about what it's been like the last couple of years and the expansions and the growth that it's experiencing with the program.
Well, St. Joe's is one of the premier obstetrical providers in this area, right? We are seeing about 4,000 babies being born each year at St. Joe's Hospital, and we are so proud of the work that we're doing there. We have attained perinatal certification the past couple of years, and that's an accreditation body that comes in and looks at your obstetrical services and determines that you're providing the best care that's up to, you know, the best current standards that we have. And so we passed that with flying colors. And then just last year, we went through a very rigorous process and we became a baby-friendly designated hospital.
And what does that actually mean?
So baby-friendly, yes, what does baby-friendly mean? Baby-friendly is actually a designation. It's part of an initiative that was launched about, I think it was 1991, by the World Health Organization and the United Nations International Children's Fund. And it was a global effort at the time to implement these 10 steps, they're called. They're basically evidence-based practices, along with the International Code of Marketing of Breast Milk Substitutes. And the purpose of that was to promote breastfeeding around the world. And I think to talk about the Baby Friendly Initiative, you have to have some understanding of the history. We all know that, well, I guess we don't all know, but we are learning more and more about the benefits of breast milk for infants and children, right? And and we also know that breastfeeding, infants and children receiving breast milk, is a biological norm. That's something that we have developed through our evolution.
Yeah.
It's only been in the past few generations or so that we have seen a swing away from breastfeeding to formula feeding. And there's lots of reasons for that, for sure. But as that was increasing in the United States, there was marketing around the world to promote formula feeding in, you know, lots of places, developing countries. And then, so what were we seeing as a result of that? We were seeing an increase in infant and childhood disease
Well, if
and
you don't
death.
have clean water,
Exactly.
you can't have clean formula.
Right.
So,
you
but
don't
yeah,
have you don't always have the resources to buy it, and yes. So
it's interesting because, you know, my mom had her children in the late 70s, 80s. She breastfed my one sister for maybe a week. It was all formula fed back then. It was not even, she said even when she was trying to breastfeed my youngest sister that she had no support. She didn't know how to.
right.
And that's so different now because 3 years ago when I had Keaton, I went into the hospital thinking, I'm going to give it the old college try and I'm going to breastfeed.
Okay.
But I went into it thinking if I can't, because I had a mom that couldn't do it, I was like, if I can't, I'll just go to formula if I have to. But I felt like, first of all, I had a baby that was good at it, so that helped. She was helpful to me, but I also felt like I had so much support at the hospital, so much support.
And that is good to hear,
Yeah.
because we have been on a journey this past 3 or 4 years, and I really see that our practices have changed in that regard for the better. And it is not unusual for us to hear that from moms now and from family members, that I really felt like I got the help that I needed in the hospital. Or, you know, I had my last baby here, I feel like I get so much more breastfeeding education this time, or, you know, staff really were there to help me and give me the information that I needed.
I honestly even felt like at some point maybe I would have been afraid to ask for the help because it's like you don't know what you're doing, everything's so new. But the hospital staff made sure, they were like, we're going to have a breastfeeding consultant come in here, and that person came in like multiple times, even though I at one point was like, I feel like I have it, but they just kept coming in to make sure I had it, and that made me feel good too.
Makes me feel good to hear about your good story there.
Yeah.
So the Baby Friendly Initiative is predicated on these 10 steps. These 10 steps are evidence-based practices that hospitals implement, and they have been shown to give mothers we start with the education information and then the support that they need in the hospital to help them be successful, or, you know, to work in that direction. So some of those steps, you want to hear a couple steps?
Yeah, sure. I'd love to.
So a couple of those steps, of course, is to train all staff. in the skills and with the education that they would need to be able to assist mothers. I think people didn't realize until, you know, the past number of years as we work towards increasing breastfeeding rates across our country, which has always been one of the Healthy People goals, and around the world, that, you know, healthcare providers did not get a lot of information through their educational programs related to the importance of breast milk feedings and how to support families better. So we started with that. All staff went through, the nurses went through about 20 hours of education. Physicians, nurse midwives, everybody got some education so that we can better help parents. And then when we come in, the practices that you can, that you'll experience, for instance, it starts with, well, actually it starts before delivery, when our OB offices provide information about breastfeeding and common things that you might want to know about ahead of time. And then when the baby is born, we do a really good job, I think, of placing the baby skin to skin on mother's chest. Did you have that experience?
Oh, yes, yes.
Now, you mentioned that your experience was different than you expected in terms of you ended up with a C-section.
But they made sure as soon as the baby was ready, she was laying on me.
And you know what? That is not always an easy feat, is it? Right?
Yeah, I mean, my arms were like this. I'm like,
Yes.
but she was on me, and they had a nurse helping me hold her because I couldn't really hold her myself. But I wanted, even though like I went into it like thinking I wanted a vaginal delivery, but I was like, I was open to whatever.
Yep.
I was just so happy to have that skin to skin after the fact, even though I had to have a surgery.
And isn't that nice that you can still have those experiences? And so the nursing staff did a really good job of working towards that in the labor and delivery area, so that now the nurses are comfortable in helping moms have some skin-to-skin time. And mothers report, you know, I really felt better because I had a cesarean section the last time and I didn't get to hold my baby for, and now most mothers are the first person to hold their baby. And so that's really nice. So it starts with that, skin to skin in the OR, skin to skin on mom's chest after vaginal delivery, and whenever we can, we keep the baby there until that baby, because we know that babies go through various phases after they're born. And we have to, you know, let the baby get to the point that the baby's ready and interested to breastfeed if mom's choosing to breastfeed. And so sometimes that takes 30, 40 minutes, and sometimes it could take a little more than an hour or so. So we encourage parents to keep that baby on mom's chest, skin to skin, until that baby, you know, has the first breastfeeding.
Is there any? I know I didn't really have this. Was afterward. This is kind of skipping ahead. After, once you've gone home and you've been discharged, I don't remember, and I don't know if I just blocked it out, but I don't remember having that support afterwards at home, while at home.
St. Joe's does offer that.
Okay, I don't know that I didn't take advantage of that, or it wasn't readily. It was probably there. Maybe I just didn't take advantage of it. But I know I didn't have that.
You didn't feel like you had much support after you got home?
No, but maybe it was just I didn't want to be bothered. I didn't need it. Maybe I just did my own thing, and I was able to breastfeed. But it wasn't like I had someone on the phone, you know, or how's it going today? Are you doing okay? You know, I didn't have that, and I almost feel like that's what St. Joe would do.
St. Joe's is really good at that.
Yeah, that's what it sounds like.
They're good at looking at the continuum of care, from pregnancy to the hospital stay to what happens after women go home. And I'm glad that things worked out for you, but many women, and you know, that's the thing about as we work to protect and promote breastfeeding, we know that, you know, you get started in the hospital, and we do our best to help get things off to a good start before you go home, but it takes a village, doesn't it, to be successful with breastfeeding. It's not just a one-on-one activity, it's the information you get from your healthcare provider, the support that you get in the community. So I'm happy to say that many of our pediatric offices have lactation consultants available in their offices, so you can make an appointment and go back to see your pediatrician and see a lactation consultant at the same time. We also have a breastfeeding clinic now in Ann Arbor. I don't know if you've heard about that, but we have a pediatrician, lactation consultant, Dr. Lisa Hammer, who has a
She's
breastfeeding
been on
clinic.
the show,
Lisa.
actually, yeah.
Oh, she
Yeah.
has.
Yeah.
Well, then
Yep.
you have heard about
I've
her
actually
breastfeeding
went to
clinic.
see her
good.
after because my daughter breastfed for about 2.5 years.
Good for
So I was like, I went to see her to have her help me wean. Because that's breastfeeding is an ongoing thing. You learn as you go. So
Yes.
to me, that was the hard part because she was older and she wanted it still. So it was like a hard transition to get her to stop wanting it.
Good. Well,
Yeah.
I'm glad that you've found that support for that
Yeah.
need. And yes, so we have, after discharge, we can refer women to a lot of things in the community. You know, the pediatric offices, Dr. Hammer's breastfeeding clinic. We have a mother's breastfeeding support group that meets at the hospital. And then, of course, there are community groups in the community like La Leche who are doing really good work around supporting breastfeeding.
Okay.
Yeah, I think that's a good question too, because I think when you are breastfeeding, when you go home, you do have doubts. And a lot of people ask you questions like, how much milk is your baby getting?
Right.
And you're like, I don't know.
Right.
Like, I don't know. I have no idea. Or the big one I had in the first day or so was, when is my real milk coming in? Because she seems pretty hungry right now, you know? Like, I felt like, and then I was like, do I have enough milk? You know, like those are the questions that I feel like if you've never done it before and you don't have support. So I had a sister that had done it, and she was a big support for me.
That was great.
Yeah.
Yeah, you're lucky to have a sister.
Yeah.
Not everybody has a sister.
Yeah.
And we could spend a couple of hours sitting around,
Yeah.
and we should do that sometime.
Yeah.
Talking about all of those questions, because you know one of the common worries that leads to women discontinuing breastfeeding sooner than they had planned is that worry of, is my baby getting enough?
And you know, I think that's a big question that people that formula fed ask you.
Yes.
Because they're like,
Because
so
they're
used
used to
to the bottle. Yep.
And we know that, you know, if a baby is growing and thriving and having wet and poopy diapers, generally they're doing okay.
Yeah.
But it's getting back to that trusting that things are going to be okay. And also, of course, getting the education so that you know, I would recognize if things weren't going well.
Yeah.
Right.
Yeah.
Absolutely.
Well, we're going to take a break right there, and when we come back, we'll talk about more of the baby-friendly designation, and we talked a lot about breast milk and stuff, but let's talk about some of the other stuff that the hospital has to offer. So we'll take a short break, and we'll be back with more from Ruby. We're back with Ruby Shapiro to discuss St. Joe's baby-friendly designation. Welcome back to the show, Ruby.
Welcome back.
Thank you.
So we were talking a lot about breastfeeding and stuff like that, but it's also about the whole birthing process and feeling comfortable during the birthing process, because we all know it doesn't matter who you are, you're going to be in pain somewhat. Some people feel the pain worse than others, but you're going to be in pain when you have a baby. So you wanted to mention something about...
Well, yeah, Dana and I, we both did the epidurals, and there was no questions. It was going to happen. We were going to do it if possible. So, but something else that I saw that the hospital offers, and I just read about this, was the nitrous oxide.
Yes.
Which, you know, 3.5 years ago I didn't know about, and I don't know if it was offered, if it was at the hospital.
I think it probably depends on the hospital you went to.
Yeah, I don't think it was offered, and looking back now, I don't know if I would have taken it, maybe not. But can you tell us about that?
Sure. Nitrous oxide was introduced to St. Joe's a few years ago. And have you ever gone to the dentist and had that inhaled gas that kind of takes the pain away for a short period of time?
Yeah.
That's nitrous oxide. And nitrous oxide has, it has a long history. And then childbirth areas kind of got away from that in favor of other things, but it's seen a resurgence over the past number of years because it's a good method of taking the edge off of pain for women in labor. It's short acting, it's safe, the woman controls it during her contraction. She can inhale it, let it go after the contraction. And it works very well for women. Some women who choose not to have an epidural might feel like, you know, if I had a little, you know, just a little bit to take the edge off, I could do it. Yeah. And nitrous oxide works that way. It can also work very well for women who plan to have an epidural a little further along, because you do want to be further along and get your labor well established before that happens. So it can be useful there too.
Are there downsides to it? Or is there cases where it might not work, or does it usually always work in some capacity?
Oh, you know what? I am not the best one to ask about that, but we're not usually given it with other things. Okay. But there are very few downsides to it.
Sure. Looking back now, yeah, I probably would have taken it. I would have taken it.
You may have.
Yeah, maybe
you may get another chance.
Yeah, maybe.
Or not, whatever.
I don't know. Yeah, no, it sounds like a great option. I actually don't know anyone that's
right. I actually don't think, I knew that it was a possibility when I had my baby, but I mean, I probably could have used it at the beginning because it took a little while to get my epidural, but I didn't even think about it during the whole process. But it's good to feel some of the pain anyways. You're alive. It makes you feel like you're alive.
That's very individual, isn't it?
But is it true that St. Joe's also, if you are interested, you could get a midwife in there too? Do they have do you work with a midwife program?
We do have a midwife program at St. Joe's, and they are available in the community, so you could start your pregnancy off by seeing a midwife and then continuing to see a midwife through your pregnancy and delivery and postpartum. Yes, that's a very good option for many people.
Can you bring a midwife in if, like, during your labor?
Yeah.
Can you
put it on call, like, can you send me a midwife, please? I need help.
Oh,
or do you have to start? You have to start like from the beginning.
So you may be thinking of a different thing, because we do have nurse midwives, and they have, you know, they have their own patients, so to speak, and they are available on the unit every day. There's midwives that staff our triage area and things like that, and assist in the delivery room at times. You may be thinking though of a doula. And so doulas are those people often in the community who have special training around being a support person for mothers in the labor room, as well as sometimes in the postpartum period, sometimes at home. Yeah. The research tells us that most women will do really well if you and your significant other have another support person in the room with you.
Oh, really? So that's really? I didn't know that, because you hear a lot of people when they do have their second kid, they'll say, I just want it to be us in the room. Where your first kid, you're more likely to invite maybe your mom or like someone that makes you feel good about yourself, you know?
Yeah. And maybe the second time around, if you've been there, you know what to expect, and you want to have that experience. And I'm not quite sure if the research would support like second or third time. I'm not quite sure if it was specific. But we do encourage that extra support person, and after the baby's born, I think that's an opportune time to call in the troops, so to speak. Now, we think about, let's go back to that skin-to-skin time right after delivery. You know what it's like when the baby's born and your parents are waiting outside, or you have all these people and they're just fighting at the bit to come in and see the baby. Well, I think most people, most moms and babies will probably be better off to a better start if you would just allow yourself that hour and a half and keep the baby on your chest and get breastfeeding started before, handing the baby off to, lots of other people. And yeah, everyone wants to see the baby. I can relate.
Sure.
But I think people don't know that ahead of time, and then they don't know how to let people know, well, I don't really want you to come in for a little while after. So that would be one word of advice I would give to new parents. To give themselves that time afterwards, just time to be together and allow the baby to kind of come around.
Okay.
What is the Cuddler program?
So the Cuddler program started, it's started in different places in the country. And it started in response to babies who were experiencing withdrawal because maybe the mother had to take or either had to or chose to take opioids during pregnancy. And so these babies were experiencing withdrawal. And when a baby is having withdrawal, they really need things that can help them get through that. And one of those things is to be held frequently.
Yeah.
And not all parents are not always available if you have a longer length of stay, they don't live in the area or something like that. So that started the Cuddler program. And we can use the Cuddler program so that's basically volunteers coming in to cuddle a baby when a parent is unavailable.
Wow.
And it's kind of expanded to include other things.
And
Yeah.
real quick, who are the cuddler? Who can be?
Volunteers.
We
who
have
is
a volunteer program
program?
at the hospital. It's the Cuddler program is separate from any other volunteer
Okay.
activities
Okay,
that
so-
people do. So it's not like any volunteer can come up to the unit and cuddle a baby,
Gotcha.
but they're specifically screened and chosen for
Aw.
that work.
Well, we're just about out of time. But if you wanted to just mention maybe why people should choose St. Joe's to have their baby, because I wouldn't, if I had a second baby, I would be definitely going back to St. Joe's again.
I am so glad to hear that. And I think people should choose St. Joe's to have their baby. St. Joe's is a community hospital, and we pride ourselves on the fact that as a community hospital, we work to ensure the health of our community. And one of the things that we have done really well with that is through all of the actions that we're taking to get moms and babies off to a good start, our baby-friendly designation. And I sometimes go in and talk to parents too, and I hear things like, oh, I just feel like your hospital does such a good job of providing breastfeeding support, or I delivered my baby somewhere else and I chose to come to St. Joe's this time. So we hear overwhelmingly from moms, families that come to St. Joe's that they have a very good experience. And I know that staff do the best that they can to ensure that parents and families get off to a good start.
Well, thank you so much, Ruby.
Thank you.
You're
It's been a
amazing. And what
pleasure.
you do is amazing. We said this earlier. There's people like you that are you're just a special type of person to do what you do, especially day in and day out and for many years. So thank
Well,
you.
thank you so much.
Thank you so much. And if you have an idea for a parenting show or topic or guest, you can talk to us on Twitter and Facebook at #CTN Ann Arbor.
For more on programming and services at CTN, visit a2gov.org/CTN. Visit youtube.com/CTN Ann Arbor to see all that we have to offer. And remember to like, comment, and share. Thanks for joining us on this adventure in parenthood.